Poverty and Homelessness Board. This is Thursday, January 18th, 2024, and we are doing this meeting by remote strictly today because of weather considerations. So, Kate, do we need a roll call, or I can just pronounce who I see who's here? And actually, I'll call your name out if you have anything that you need to say at this point in time, Kate. If we have a moment, and Dr. Ludke, if you'll bear with us for a moment, just to see if anybody needs a quick check-in. I'll go down my list. James Buell. And if you don't unmute your mic, I'll just go on to the next. Rosie Marquez.
I'm here, and I'm St. Vincent de Paul Supportive Service for Veterans Families. So we are open. We're working from home, so we are helping our veterans.
Right on. Amanda Border. Carly, oh, there you are. Sorry. And Carly Walker's here. Carly.
Hi, Carly Walker. I'm calling in from my sister's house. This is my second week back from maternity leave, so I'm here mostly to listen, but I'm the HMIS supervisor.
And congratulations and welcome to the back into the 4A.
Thank you.
Erin Fifield.
Yep, Erin Fifield, staff with the City of Springfield.
And then Gina Armijo.
Right here, administrator over at McKinsey Ridge SRTF in Junction City.
Thank you. And Kate Budd.
Thank you. Just put the Lane County non-emergency line in the chat. This is where we're directing folks if they have unmet needs to learn more about what is available now and what is being put in place today and in the future. So feel free to utilize that line or share that line as the need arises.
Very good. Our list of participants is growing, so I'm going to call out who I think are the executive committee members at this point in time. So I'll go down the list. Mayor Vinnis.
Yes, glad to be with you all. Thank you.
Thank you for being here. And let's see, Chris McAllister.
Chris McAllister here, representing a vice chair for homelessness. Sorry, unmute button.
Thank you, Chris. And Dr. Foster.
Dr. Willie Foster from the Health Committee.
And I think I've called out everyone who is actually on the executive committee. If anyone is on the executive committee and I've not called your name, please state your name out loud right now. Then we'll, Kate, with your approval, we'll move down the agenda. Does that sound good?
Yes, please.
Then let's go to the consent calendar. Before we get to Dr. Ludke's Shigella bacteria infection precautions presentation, let's look at the consent calendar. We have before us a consent calendar, which includes minutes from September 21st and the December financial statement. Do I have a motion? Looking for a motion to pass the consent. Moved by Vice Chair McAllister, seconded by Mayor Vinnis. Any discussion to the motion? I'm seeing none. I'll call for the vote. Those in favor, please say aye.
Aye.
Aye. Opposed, if any? Passes unanimously with all members present voting in the aye. So we'll move directly. Dr. Ludke, thank you for being with us today. And I'm sorry it took us a few moments to get to your presentation. I know you have so many things on your hand, particularly right now, with so many county-wide issues. But if Dr. Ludke, if you're prepared and ready, I'll just turn the mic over to you for a presentation and questions on the emerging Shigella bacterial infection. Dr. Ludke.
Very good. Thank you, Commissioner Farr. I'd like to share my slides. Am I able to do that while the other screen is up?
Yep, let me just make sure if you're able to, if you have a share option, go right ahead.
I have a share option and it says cannot share while other participant is sharing. Let's try it again.
I see your face. That's a good one. Go Utes.
All right. Are you seeing slides now?
Yes.
Yep.
Wonderful. Okay. So thank you for the opportunity to join you today. I am going to, oh my gosh, sometimes computers are your friend and sometimes they just make your lives more miserable. Okay. There we go. Happy to discuss the Shigella concerns. As many of you are aware, there was a fairly significant outbreak beginning in December in the Tri-County area up around Portland. Ended up with cases across 6 counties, although the majority are in Multnomah, Washington, and Clackamas counties. And consequently, as I understand it, that's why I was invited to share what's known in that space and what we can do in a prevention space to keep our residents healthy. So first of all, what is Shigella? It's kind of an uncommon name. I suspect many of you don't even know what Shigella is. It's a gram-negative bacteria, very much akin to Salmonella, E. coli, other ones you probably have heard of. It's actually in the same family as those organisms I mentioned. It is not normal flora. That means it's not normally inside our intestines. Unlike E. coli, we all have E. coli inside of us, and many farm animals are loaded with Salmonella, E. coli, Klebsiella, these other bugs you've probably heard of. But Shigella is not normal flora in those animals, and it's not normal in us. So when it shows up, it's usually a pathogen, meaning it causes disease. It lives in the intestines when we get infected, typically causing large intestine and small intestine infections. It can cause severe disease, and you'll see some data showing some of the severe diseases up north of us recently. Typically, we are exposed by contaminated food and water. So this is a fecal oral organism where contaminated stool, whether it's from humans or uncommonly other animals, gets into the water, and then humans ingest that contaminated food or water. And the bacteria then gets inside our GI tract, and this is one of those bacteria that can actually invade the cells that line the GI tract. So unlike norovirus, the cruise ship virus where you get diarrhea, that virus doesn't invade the GI tract, so you don't get bloody diarrhea and lots of severe disease. Shigella can really invade and cause bloody diarrhea and terrible disease. Some of the strains of Shigella produce these nasty toxins that can cause real problems. And many of you have probably heard of some of these toxins in the lay press. Shiga toxin is one of them. There's 2 main types, type 1 and type 2. Type 2 is the worst. It's the one that usually leads to kidney failure in little kids. If you remember the Jack in the Box outbreak 20 years ago, a number of kids got kidney failure, had to go on dialysis. It was from a Shiga toxin producing organism in the same family as Shigella. So one of the reasons we care a lot about Shigella is its infectious dose is very low. Whereas with Salmonella, we can ingest 10, 20, 30, 40,000 Salmonella bacteria and not get sick. It only takes a couple hundred, sometimes even only 10 or 20 to make humans sick. So whenever we see a Shigella case, especially if it's in a food service worker, we get pretty concerned because things have to be really clean before we let him or her go back to work. So just keep that in mind. Very few organisms to cause illness. And again, as mentioned here in the last bullet, humans and higher primates are typically the known hosts. It's very uncommon to find it in farm animals and such, like with Salmonella and E. coli. So shigellosis is the infection from Shigella. And typically you get sudden onset of severe diarrhea. Again, because it is able to actually attack the lining of the intestine, you get nasty bloody diarrhea. Many people get fever and stomach cramps within a day or 2 of the infection. So this is not like hepatitis A, where you get exposed to it as a houseless person, and a month later you turn yellow and you get jaundice. This is in a couple days, pretty quickly. Symptoms last up to about a week in most people, provided they have a good immune system. And unfortunately, we have some people out on the street and others who have immunocompromised, and they're at a higher risk for severe disease. And the vast majority of these cases resolve without hospitalization. Many do, in fact, need to be treated with antibiotics, but they resolve without hospitalization. A very small percentage, in the 2 to 5% perhaps, develop some severe post-infectious issues. Some of you have probably heard of post-infectious arthritis. This ongoing, lots of pain in your joints, can be for years, actually. Shigella is one of the organisms that can do this. It's not the only one. There are others that can do it, but Shigella is one of the ones that can do that as well. So specifics about the Portland Metro cluster. There are 4 main species of Shigella that we care about, and in this cluster up north, 2 of those species are involved, Shigella flexneri and Shigella sonii. If you've been reading the lay press for the last few years, you've seen both of these in the lay press. There are outbreaks across the country on occasion. These are not rare. They're uncommon, but they're not rare. The Shigella flexneri outbreak is up to 54 cases as of a couple days ago since September. Close to 3/4 of those cases are in people experiencing houselessness. So this is the one that we are most concerned about for the houseless persons. And sadly, 60% of them have been hospitalized. Again, that's a high rate. 60% of people who get salmonella don't get hospitalized. If that were the case, our hospitals would be overrun. This is more severe disease. About 2/3 of them have reported recent polysubstance use, primarily methamphetamine and fentanyl. 7% of the flexneri group were men who have sex with men, or MSM, as we say in public health. And we have not, the 3 health officers in those 3 counties up there have not been able to identify a clear geographic pattern or a common source. So, for example, they're all getting their water from the same place, or they're all eating from the same vendor, or something like that. We often like to find that common source, which we then can shut down and prevent more cases. That is not what we are seeing up in the metro area for Shigella flexneri. Now, Shigella sonii has a little bit of a different epidemiology. Fewer cases, only 19 since September, but almost all the cases have been men who have sex with men, and it's very clear that oral and anal sex are an additional risk. About almost 1/3 are reporting housing instability, so significantly less than the flexneri cases. And close to 1/3 are reporting methamphetamine use. Also, unfortunately, unable to find a point source or common source. Those are the phrases that we use in public health. Point source, continual source, common source. The church picnic where the potato salad was contaminated. We're not finding that for Shigella sonii either. And in this particular organism or species, sonii, the transmission is primarily, again, intimate contact. So sexual intercourse, anal, oral sex as well. So I thought it'd be reasonable to pull up the data for Lane County over the last few months. So the 60-day period from November 10th to January 10th, we were able to pull up cases. Lane County had 3 Shigella cases. All 3 of those cases were in people who were stably housed. One did require hospitalization. Again, we respect Shigella. It's a nasty organism. 1/3 of the people getting hospitalized, that's just badness. The Portland Metro outbreak strains are not circulating here. So we did some deeper molecular characterization of these isolates here in Lane County. They're not the ones circulating up there. So it hasn't come here yet. I hate to say the word yet, but we all know a lot travels up and down the I-5 corridor, so certainly we're at risk down here. Looking at the full calendar year for 2023, we had 12 cases in Lane County. 1/3 of them were unstably housed or unhoused. And if you look at our unhoused rate, it's a little less than 1%. 1/3 of the cases that had Shigella were unhoused. So, of course, they are significantly overrepresented in this group, even though we only had 12 cases total. I always like to give a little caveat or disclaimer. I'm not a lawyer, but I guess I feel the need to say that our data is not perfect. We are aware of these 12 cases reported to us. We probably had 30 or 40 or 50, again, because many people get better over the course of a week on their own, and they don't show up with severe disease. We don't have perfect data, but this is the data that we do, in fact, have. So what can we do? I think it's important to note right at the outset that we can prevent Shigella infections, and a lot of it's common sense. Basic personal hygiene is really the most important. That includes frequent hand washing, so making sure that those persons who are unstably housed or on the street in a homelessness situation, they have access to hand washing stations and such. I've seen over the last few years a lot of work in that space. Many more of those are available, but that can be very, very helpful. So not just running water, but access to soap as well. We want to make sure that persons who are perhaps preparing foods, working with kids, changing diapers, that they have extra special personal hygiene. You can really spread this organism quickly. Again, it only takes, a couple dozen organisms. You have to be so clean to prevent spread. So it's really important to make sure that this knowledge is given to people who may encounter this organism. Toddlers and small children should be supervised for proper hand washing, not just taking it. Did you wash your hands? Yes, we want to make sure that they wash their hands. And they sang the happy birthday song for 20 seconds. They're actually soaping up their hands. It takes a little bit of time to kill this bacteria, but you can kill it pretty easily with soap if you do it correctly. And then a few other tips. If somebody does have diarrhea, they shouldn't be preparing food for others. Anyone who's ever worked in the food service world knows that McDonald's and all these other groups, they make sure that People who have a diarrheal illness are either given a different duty or told to stay home until they're totally cured, because you can spread disease to a lot of people quickly. So anyone who's has diarrhea, we don't want them to do food preparation. We want to make sure, and this is hard with people who are in a houseless situation, to not share, drinks and straws and chapstick and these sort of things that can potentially spread this organism as well. We do reliably see challenges with diaper hygiene. That's why I mentioned it again, that, there are people on the street, unfortunately, who have kids and such, and they might be in diapers. We want to make sure that they're aware of good hygiene in this space. And then the final bullet is really how we look at it from the public health space. How do we interrupt the transmission? So it's one thing to wash your hands, but we still haven't stopped the transmission. It could still be out there. You still come in contact with it, but you wash your hands and you kill it, and then you don't do the hand to mouth and infect yourself. But if somebody has this infection, it would be nice if we could, and they're houseless, it'd be nice if we could do some hoteling, put them into a hotel space until they are no longer shedding the organism. We want to make sure we get safe sex messages out there to interrupt the transmission while somebody has the organism and can transmit it. So physically interrupting the transmission cycle is also quite important. And I'm going to look at Kate's face to make sure that I understand how badly I veered off course on this, but I want to make sure that there are other organisms that are transmitted the same way. And hepatitis A virus is one I've been worried about for a very long time. I suspect some of you know this. There have been some huge hepatitis A outbreaks in people who are unstably housed or unhoused in this country in just the last few years. It kind of started in San Diego about 5 or 6 years ago. They had 600 cases. 20-some people died of hepatitis A, which should frankly never happen. Unfortunately, it did. And the reason I put up this slide from the CDC, the two states in black, Kentucky and Florida, had very large outbreaks during this 5-year cycle where CDC captured the data. And we in Lane County are at risk as well. We have a fair number of houseless people, unfortunately. Our hepatitis A vaccine rate is far too low for my comfort. And we have seen big outbreaks in houseless people in this country, and we should really be acknowledging that. And by way of giving you an idea how big they can be, in a typical year, for the last 20 years, Kentucky only had 100 hepatitis A cases. In the calendar year that they did this study, which was 2020, they had 4,000 hepatitis A cases. So this is not a tiny number, and we're at risk, and this is one of the organisms that I'm frankly worried about. It spreads the same way, fecal, oral, contaminated food and water. We need to do better. So I'm going to stop there. Happy to take any questions on Shigella or other items in this space.
Thank you, Dr. Lipke. What a great presentation. Can you make those slides available to the PHB through Kate, perhaps?
Absolutely. Kate, if I send them to you, can you take care of the logistics?
Absolutely. Please do that. Thank you.
Very good.
Thank you. Then I'm going to look around for hands raised for questions or comments to Dr. Lipke. And I'm going to just mention something out loud that just, Dr. Lipke, freaks me out, something that you mentioned. You talked about people in homelessness situations changing diapers on babies. If that doesn't break your heart, you don't have a heart. So looking around for questions or comments for Dr. Lipke.
Q, please. Chris McAllister.
Thank you. I have Mayor Vinnis, followed by Chris McAllister.
I also thought I saw Rosie earlier. I don't know if she made it to the queue. So I just guess what I'm interested in, Dr. Lutke, is what you would like this body to do with this information. What are you hoping for by speaking to us about this? Are you hoping that we'll make a recommendation around hand washing stations or prioritizing folks for hotels, or what would you like to see us do with this?
Very good question, Mayor Vinnis. Thank you for it. I would think probably 3 main areas. The first is magnify the messages and make sure we have the same message discipline on this. It hasn't arrived in Lane County yet. We are at risk, and these are the ways moving forward. So I think that would be number 1. Number 2, making sure that the messages that go out there are actually the evidence-based messages. We saw during the pandemic, there were recommendations to do A, B, C, D, whether it's, take hydroxychloroquine or whatever it is. This is an easy bacteria to kill with soap and water. let's make sure the right messaging gets out there. And the third, I think, is a little bit more difficult for me because I guess I don't fully understand all of the roles of this group. I put in hoteling because there has been success across the country on stopping some of these enteric disease outbreaks with really interrupting the transmission by pulling people out of the transmission cycle. I don't know if this group has the resources to say, okay, we're going to put somebody in a hotel. It's going to come out of this budget item. I don't know the answer to that. But how can we work together in that space to try to make a difference and interrupt transmission?
Chair, thank you. Can I ask just a quick follow-up question, Chair?
Please, that was a great initial question. Continue, please, Mayor.
So I guess the other question that I have is that in the beginning of the COVID outbreak and through much of the pandemic, we increased the amount of hand washing stations. And I actually know with the stat, I don't know how many hand washing stations are out there now. And so I'm also wondering if that's a recommendation that you would be welcome from this committee around maybe increasing the investment in hand washing stations.
So if I could respond to that, first of all, I would strongly support it. And secondly, I wonder if there is a way as entities contract with these CBOs out there doing this work on the street to make sure it's part of the contracting. So it's routinized. Now, of course, it's easy to routinize something and assume all the resources are there. Maybe all the resources out there. I'm not sure, but it would be nice to make it part of a template that this is part of our response every time, because clean water and clean food are really, really important. A lot of people can get sick very quickly.
Thank you so much for that, Dr. Lutke, and thank you, Mayor Vinnis. I think one thing that I will do, Mayor Vinnis, is I'll prepare a statement for the next board meeting, which is coming Tuesday, so that we encapsulate Dr. Lutke's recommendations. And as Dr. Lutke has suggested, make sure we have the same message, and the messages are evidence-based. We will do that for the next board meeting. Thank you, Dr. Lutke. And Chris McAllister, Mayor Vinnis asked a question that maybe you, as part of your turn in the queue, can answer. I'm curious how many hand-washing stations are on the street. So, Chris McAllister, you're up.
Yes, sir. I cannot speak to, thank you, Mr. Chair, thank you, Dr. Lutke, and thank you, Mayor Vinnis, for that question. I cannot speak to how many hand-washing stations are on the streets right now because we don't even have bathroom access on a lot of the streets right now. With the freezes and whatnot, we've not been able to maintain safety stuff. My biggest question is, and this kind of ties into Dr. Lutke's talk about hoteling, having $10,000 couldn't make hotels appear. All the housed people were able to pay the higher rates to get in, and so we didn't have any hotels in this county within 3 hours of the first outage. And so that said, my question is, some of us have the symptoms that you're talking about, but we don't know how to verify it. If you have the toxin right now, if you have symptoms, how do you find out? And if you are in that first week or so and you're weathering it, is there signs to show that you had it?
Chris, are you finished or did we lose your audio?
I trailed off. I'm sorry. I'm finished. I'm willing to take a response if you are ready.
Okay, very good. So I'll take your last point first. The serology testing, which means looking for antibodies for Shigella, is in fact based on good science, and you can test for it. However, it takes a few weeks to identify whether or not you were recently infected. So this is not a stat test, right? We can't get the test results immediately. It takes a little while. It typically does not impact patient care, so not many labs do it. And that's what we run into a fair amount of times in the clinical space. However, if somebody is symptomatic with these symptoms now, especially if they're getting worse, we would like them to be seen. Now, many people don't have a primary care provider, but we have, free clinics, so to speak, safety net clinics where they can be seen, whether it's Volunteers in Medicine or Whitebird or the community health centers of Lane County. There are opportunities where they can be seen most of the time, not all the time. We would like them to be seen. If they have had several days of diarrhea and now it's day 5 or 6 and they're getting better and they don't have bloody diarrhea, I wouldn't be in a rush to go be seen right away. They're probably getting over it and they're probably okay. But again, this is a challenging, Monday morning quarterbacking as a doctor when I'm not seeing the patient.
Yes, sir.
It's a tough thing to talk about directly, patient one-on-one care.
May I speak a direct response, Mr. Chair, to that?
Continue, please, Chris.
Thank you, sir. If people did have the bloody diarrhea and are having pain in their kidney and sides, what should they be doing?
They should be seen by a primary care provider or go to urgent care. Bloody diarrhea is a nasty thing. It's not just visually nasty. That means that you have the opportunity or the potential to become anemic pretty quickly. And once the organism gets into your bloodstream, it can go everywhere that blood goes, and you can become what we call septic, or you can get sepsis. And that's how people end up in the hospital when they get this organism. They get septic with it. It gets into their bloodstream and spreads elsewhere in their body. So if somebody is having bloody diarrhea and they're not feeling well, they should go be seen. And in this country, I'll add one more thing. The federal laws say that if somebody shows up to the door of a facility, a hospital, urgent care, they need to be seen and stabilized without regard to a bill, so people can be seen.
Thank you, Dr. Lutke. Thank you, Vice Chair McAllister. Dr. Foster, you're up.
Yeah, I was just going to make a comment about hand washing stations. During COVID, a lot of our unhoused population was pretty stable. They were at the Washington Jefferson Park. They were at other places. Now we do have our sanctioned camps, but most of the other people that aren't in sanctioned camps are along the railroad tracks, the rivers, the pathways. And I can tell you, there's not toilets and hand washing stations out there.
Thank you for that. And I think that'll be a part of my message on Tuesday, Mayor Venice, to the Board of County Commissioners. And perhaps you can forward a similar message that this is something we do need to pay attention to. Dr. Lutke says it over and over again. The first form of defense is hand sanitation. I see no one else in the queue at this point, Dr. Lutke. Anything you'd like to conclude with?
No, I thank you for the opportunity to speak to this. Thank you for the opportunity and, using your professional networks to get the word out and make a difference before things get bad. So well done to each of you.
Dr. Lutke, this is Dr. Foster. I just had one more question. Are there any plans to get the hepatitis A vaccine actually back out into the community with mobile teams? Because that's going to be the best thing is going out with Occupy, with Black Thistle, with CORE, people that have relationships with the homeless, and persuading them to get that vaccine. Asking them to come to clinic doesn't catch very many of them.
I really appreciate that question, Dr. Foster, and I will tell you, we have struggled in this space. On the one hand, it's wonderful to have an effective vaccine against an organism we're concerned about. We don't have a Shigella vaccine, period. So we wish we did, but we don't. But we have a really effective 2-dose vaccine series for hepatitis A. And we have gone out, we local public health, our communicable disease nurses have gone out to multiple camps and spent a fair amount of hours doing this. And we have not nearly as much uptake of the vaccine as we would like. So we need help from you and other organizations to try to get people to choose to be vaccinated and protected so we don't get one of those nasty Kentucky-like hepatitis A outbreaks. That really is a problem. Thank you for that comment, Dr. Foster.
Thank you both, doctors. And Chris McAllister, your hand is up again. Is that a shadow of the former hand, or do you have another?
No,
question?
sir. It's actually a question that I've been this morning trying to get the boiling notice and these other items put out in Spanish because we are only getting English and only people with internet and mobile access are able to utilize the translation function on Sub's website because Springfield and Cottage Grove both are down. Is there any public health resources in Spanish, in Mom, in the other languages that we need where we don't have power, where we don't have water access that we can distribute?
I'm assuming that was for Dr. Lutke. The answer is
yes,
a qualified yes. So you're going to see a carbon monoxide poisoning health alert go out here in the next little bit that we're working on, and that will have Spanish links to it. Actually, they're already done. They just haven't been sent out yet. But unfortunately, with the power outages, we're seeing a pretty large increase in carbon monoxide poisoning showing up at our 2 hospitals. So we want to get a message out in that regard, and there will be Spanish for those. We're working on Spanish for the others, including the Springfield boil water order.
Thank you, Vice Chair McAllister and Dr. Lutke. And then I'll also say, Kate, Bud, you're here. Kate is our Human Services Manager. And the question regarding hotels that Vice Chair McAllister stated, I'm presuming that we have a limited duration emergency that's going on right now, that hotels will become more available. And I know that whenever possible, we are providing hotel accommodations to the extent of our resources. Is that correct, Kate Bud?
Certainly, yes. I think whenever, there's someone who has, a communicable disease, utilizing hotels are really important to remove them from the overall population of people. If that comes up for an agency, happy to have conversations about what dollars could potentially be used to provide that hoteling, and appreciate Chris's point, in the middle of an emergency, finding those hotels are extremely challenging. And so, continuing to plan around how to remove people from the overall population is important. I will also appreciate the point regarding hand washing stations. We have a number of outreach teams that are funded through the All In efforts, and providing hand washing stations as well as porta potties is an allowable expense. The challenge, of course, is that there are very few sanctioned encampments where if we were to place those items there in the spot, that the residents would be able to stay there for an extended period of time. And that often is the ongoing challenge. But we can continue to work with our outreach programs to be able to place those items when appropriate. And then lastly, I appreciate Rosie's question regarding, are there any over-the-counter meds that people can try to help if they are dealing with Shigella? And don't know, Dr. Ludke, if you have any insight there.
Hey, could you repeat the beginning of that question? I heard the end, but it kind of broke up a little bit.
Sure. Are there any over-the-counter meds that people can try until they're seen by their PCP if they're dealing with Shigella symptoms?
Yeah, unfortunately, we would like them not to do it. If they have explosive diarrhea, they can use one of the antidiarrheals, Lamodal, something like that. But we want them to be seen quickly, because they can become dehydrated, very quickly, and that's when your kidneys shut down and you get this cycle of real problems. So, and there are no over-the-counter antibiotics that somebody can take for this. And I'll say one more point: a few of the organisms in the outbreak up in the Portland metro area are resistant to multiple antibiotics, so we have to be careful. We don't want to jump the gun and give an incorrect antibiotic and cause more problems than are already existing.
Thank you, Director Budd, and thank you for your time this morning, Dr. Ludke. You went a little bit over time. I know you've got a lot of things on your hands right now, but you gave us some recommendations to pass along uniformly as well as we can, both to our jurisdictions and to anyone we come into contact with. I see that James Ewell is on the line right now, and James has a lot of contact through the FIT team, I believe, James, with some encampments. So a lot of this information, if we're saying the same things that Dr. Ludke said, then that's the best thing we can do. So, Dr. Ludke, anything else before we say farewell?
That's all. Thank you again for the opportunity, and thank you for your many good works.
Thank you, Dr. Ludke. Then we'll move down our agenda. That we're a little bit over time on the agenda, but I think that's time well spent. Item number 5 is PHB Chair and Vice Chair request for nominations. We'll be holding the election for Chair and the 2 co-Vice Chairs in our February all-member meeting of the PHB. And Kate will remind us of the date of that a little bit later here, if you don't have it already. But for now, what I'd like to pass along is that anyone who would like to have their name considered to be nominated, please forward that information to Kate Budd. And if you also have a third party that's not yourself who you'd like to nominate, also forward that to Kate Budd. Perhaps up to 4 or 5 days prior to the February meeting, in order to get that considered for the February meeting. Kate, anything you'd like to add on that?
If folks are interested, the description regarding the role of the chair and the vice chair are on page 7 of the PHB packet. And so if you have any questions, feel free to reach out to myself or to our current chair or vice chairs. And I appreciate you giving that deadline, Commissioner Farr, and would agree we'll send out an official email for nominations, but would be looking for those by Monday, February 5th at the latest.
And eligible nominees are voting members of the PHB, correct? Not that does not include the the ex officio members.
Correct. Yes.
Any questions on that process? Just for information, Brittany Quick-Warner has been the chair, and Chris McAllister and I have been the co-vice chairs. So we'll look for nominations for the new chair and vice chairs in February. Thank you very much. Then we'll move on down to item number 6 on the agenda, which is the Continuum of Care Fiscal Year 2023 registration update. And we're pleased to have Amanda Border with us today. Amanda, I'll turn the floor over to you.
Thanks, Commissioner First. Sorry, I thought I had my unmute, did not work right away. So I have a pretty quick update, so I shouldn't take up too much of your time. I just wanted to provide a quick update on where we are in terms of continuum of care things. So that should actually say fiscal year 2024 COC registration. So we are currently in that registration period. That is released every year in January and is due in March. So that was opened on January 9th. And essentially, this is really just the process where we simply register for the funding opportunity, the Continuum of Care competition, confirm our sort of COC information and our geographic area, and update our kind of basic applicant information, just so that HUD has that information when the application opens and they know which COCs are applying. So it's a pretty straightforward process. There's nothing that needs to be done. It actually moves forward as is unless you make changes. So pretty easy process for us. This is also the time that should we want to pursue being a unified funding agency, which is something this group has talked about, and we've talked about at the larger PHB group as well. This would be sort of the time to apply for that designation. You might remember the last time we spoke about this was back at the end of 2022, where we kind of left that was that the group really wanted to see where kind of the organizational restructuring conversation went around the role of the PHB and HSC and where the UFA would fit into that after that conversation. So that was with the idea that we would pursue that in this competition, the 2024. Where we've kind of left it is, the PHB is kind of remaining with the same structure, so I don't think there's any major change there. I do want to be clear, like we're not able to apply for UFA in this competition. We would have had to sort of been preparing over the last 6 months or a year to be ready to do that. So we're not prepared at this point to apply, but I did want to kind of just replug that idea that if we want to pursue the Unified Funding Agency, that's something we would want to dedicate time to this year to figure out the policies, procedures, agreements, MOUs potentially, and sort of develop how that would function and work with our co-applicants, St. Vincent de Paul and Homes for Good, to alleviate any of their concerns and sort of get ready for that for next year. So I just wanted to kind of bring it back to top of mind at this meeting and see how we might want to move forward. And I know there are maybe a couple of new folks who weren't here back in 2022. So I'm happy to sort of reshare out I think there was like a 2-page document of kind of an overview of what the UFA is and some FAQs. And so we're happy to reshare that out to those folks that might be new to the conversation. But essentially what the UFA does is really allows us to have one grant agreement with HUD as opposed to various grant agreements, and really brings those co-applicants underneath us as Lane County as the Unified Funding Agency. And so they would become subrecipients. And it streamlines some of that work that we do with HUD, but it also allows us greater flexibility to sort of move funds around between those grants a little bit more than we're able to do that now. And so just something to consider as we move forward into this year. It's something we are still interested in. And I think if there is interest from this group, I think what we'd ask at this point is to maybe have a couple folks who are interested in having those conversations offline outside of the meeting time, so that we can kind of dive into the details a little bit more about what needs to be done and answer some of those questions that we'd have to answer before moving forward. So just wanted to bring that topic back to the top of mind there. Questions about that? I have a couple of other quick updates as well before we move on.
Thank you, Amanda, and thank you for the invitation to go offline and talk more in depth with anyone who would like to do so. I'll look to the queue right now for questions and comments and begin with Mayor Venus.
Yeah, thanks so much, Chair. you know, when you started saying, I went, oh yeah, we did have that conversation, didn't we? So it's, you know, it's a distant echo for me, and so I'm just wondering if you could circulate the minutes from the last conversation we had about that. That would be extremely helpful to sort of remind me what we talked about and what some of our questions were. It'd be hard for me to pick up the string right now. I just don't quite remember all the permutations. Thank you.
Sure. I had to go back myself because I was out on leave for a lot of this year. So I had to sort of refresh my memory of sort of where we left the conversation too. So I can have Kate and Diana reshare out some of those minutes from where we talked about it and that FAQ document as well.
Does that cover your question, Mayor Venice? Right on. Thank you, Amanda. And I'm looking to the queue for further questions and comments. This is a pretty big subject. I think I don't see anybody else queued up at this point, Amanda. Thank you very much. Anything you'd like to add as in conclusion?
Yeah, just a couple of things. I just wanted to update the group. We did have our local HUD rep, Todd Atkins, come down from the Portland field office. Todd is our kind of representative up there who really works with us on our HUD COC grants, doing amendments, any changes, questions, things like that that we have. And so he came down for a visit. He hadn't been down before to kind of meet any of our subrecipients and co-applicants. And so we did a little meeting and had a great conversation, and he was able to visit the NEL and see that project. And he was very impressed with that project, very impressed with the staff and what they've been able to accomplish there, and just our work in sort of developing permanent supportive housing here as an example across the state. And so just wanted to share that messaging. And we did talk about kind of the potential for UFA here in Lane County and talked about just some of the challenges that we have with our continuum of care programs, some of the challenges we've experienced sort of through COVID and over the last few years. And I think we're getting to a better place now in terms of staffing and spending and getting to a more stable position. And so we were able to share a lot of that messaging of how far we've come, and as well as all of the sort of work we've been doing around All In and all of the things that we've added over the last few years to our kind of system of care. So just wanted to share, he had nothing but great things to say about the work that we're doing here in Lane County. And then lastly, I just wanted to put a little plug that we do have the upcoming point in time count coming up January 31st. And so we'll actually be sending out teams, street outreach teams, to be doing counting February 1st and 2nd to ask where folks stayed on January 31st. So just to keep an eye out for that. We will be again pulling primary data from our homeless by name list, as you all approved at the last meeting. And so that's going to be our primary data source. So we won't have sort of large volunteer opportunities this year, but we do have specialized teams going out to really capture those who aren't in our homeless by name list. And we're also doing some additional counting of young people under the age of 25. So we have several events set up across the county to really pull in young people to do the survey and make sure that they're counted as well. So just wanted to remind everyone that's coming up.
Thank you, Amanda. And I'm looking to the queue to see if there are any further questions at this point in time. On the point in time count, Amanda, historically we have done some pretty laborious outreach, and we're using existing data to provide that information. I think, is it safe to say that it's more consistent data that we're able to provide using the current method?
Yeah, it's definitely more consistent, and I think a better representation because we just have such a thorough database in our HMIS as it includes so many more programs beyond just our housing programs. And so it really is a thorough list, and primarily a lot of the folks that we end up surveying to sort of supplement that are already represented in our list. So that's a good indicator that we do have a pretty solid data source there with our HMIS and homeless by name list.
And regarding what happens to the data once we and all of the other jurisdictions nationwide provide that data to the agency, does the agency use that data for allocation of resources? Is that still a case, or how does that data is that data used? Do you know?
Yeah, so we won't have the data right away. We do submit that to HUD in the spring, usually around April. So it does take some time to kind of dive through it, and submit it. And then we will offer a final report of what those numbers are at that time once that's submitted and approved. And then, yeah, that data gets collected across the country in the last 10 days of January at all continuums. And so that data is all compiled at the federal level. And they do use that to sort of gauge needs across the country. And that is passed along to Congress and to legislators to understand funding allocations for HUD and for the Continuum of Care program in particular in allocating resources for that program. So it does sort of offer at least some trend data of where folks are at across the country. As we know, of course, it's not perfect, but we are fortunate that we're able to use our homeless by name list and a little bit more concrete data here locally. Unfortunately, that's not the case across the country. So many folks still send out volunteers across, their community to do surveying, which is not a perfect number. But we are hearing that HUD is moving towards using our database data more than sort of point in time count data, hopefully in the future, but not all the COCs are there yet. So
and that covers a point that we all are concerned with, that nationwide that the representation of data is not misrepresented, that it's as accurate as possible, and that everybody's using a similar methodology. You worry that other jurisdictions may be inflating their numbers, for that matter, in order to get greater allocations. That's my own personal statement on that. Then we'll move along the agenda, Amanda, if that's everything you have.
That's all for me. Thanks.
And Kate, anything you'd like to add on that?
Just that this is the third year we'll be using this homeless by name list data. And it feels like every year HUD, just very quickly says, yes, this is the methodology in which Lane County can use, and also has shared with us that they are encouraging other communities to follow suit, and that they do feel like it's a overall better way of doing the point in time count. And so I appreciate the feedback we're getting from HUD, that we're in the realm of kind of doing better than what it is expected, and that HUD is moving in that direction for all communities, which is exciting because we'll be ahead of the curve.
And thank you for that, Kate. We're close to up to snuff on our agenda times at this point in time, so we'll move down the agenda to the draft PHB charter, our continued work on the draft PHB charter, and what is the executive committee's role. I'll turn it over to you, Kate Budd. You have the floor to begin the discussion.
Commissioner Furr, I did have a queue in that. I apologize.
I'm sorry. There you are at the very top. I'm sorry, I skimmed past you. So back a step to the previous agenda item. We're still on the continuum of care. Chris McAllister.
Yes, sir. Thank you. I just wanted to ask Kate, I really appreciate the moving into this new data set. My question is, and we've had this historically, we even talked about it in the 2017 healthcare summit that we had with the county. Where can we put the data that isn't captured? Because when we have data reported by those who qualify for our programs, where do we store the data for people who don't qualify for the but-fors? I would be counted if I did not have this record, if I did not apply for a program that questioned my documentation, et cetera, et cetera. How are we capturing and utilizing the data that the system is not asking for? Because it still affects people's lives and affects their trajectory for housing. I yield.
Do we have a current answer for that, or would you like to provide that in writing a little bit more thoroughly, Kate?
Yeah, I guess what I would suggest is, I think the opportunity is just to continuing to build out programs that meet the needs of these folks who currently are not having their needs met. The challenge is creating a new database means it needs to be sustained. And there, at this point, are not a lot of ways to be able to do that. And so we'll continue to explore. And I see Carly has her hand up, so she may have other insight.
I just think,
Carly, go ahead.
Yeah, that's okay. I just think in terms of, Chris, you know how long the intake forms are for our programs. And certainly we want to ask those questions of clients who we have funding to serve. And so perhaps a better way to get at that, the issue around what do we know about people who we aren't able to serve, is to document that, who are they and what was it that was the limitation that we couldn't get around, and sort of have an informal channel of how could we improve our system and where are we not meeting people's needs. I don't think we want to ask everyone the intake questions if we're not able to give them services, but just have ways to continuous improvement and improve programs where we can.
Thank you, Mr. Chair. One second. Direct response.
Continue, please. Go ahead.
Thank you. We have collected the data. We don't have anywhere to house it. So when we go, I can't do this form because I don't qualify for these things. I still, as a provider, is there a chain where we can informally collect it on the county level so that we ask for services that meet the needs that we have, as opposed to using kind of the cookie cutter government top-down approach, which is we'll tell you what you need, and if you can answer the questions, we'll work with you. I'm afraid because when we have uncollected or stored data, we end up with unrepresented populations. I yield. Thank you so much for your time, and I'm part of this.
And thank you, Chris McAllister. Amanda, I believe that wraps up this agenda item. So we will, move down the agenda to item 7, which is a draft PHB charter. We are working on that. The executive committee role. Kate, but I will turn the floor over to you.
Thank you. And Amanda, I'll swap the share screen. All right. So at the last Poverty and Homelessness Board meeting, we took a closer look at the draft Poverty and Homelessness Board Charter, which is a result of the reimagining process that both the Poverty and Homelessness Board and the Human Services Commission has been walking through. There were some helpful suggestions from that meeting, as well as just feedback after the meeting from members. And so the Poverty and Homelessness Board Charter that you find in your packet indicates those updates, which include the chair and the vice chair roles being specified within the charter, the role of Lane County staff, and then also having the Veterans Administration indicated as a stakeholder, all important additions. And so what my hope is that Poverty and Homelessness Board members have the opportunity to review the charter and feel like they have their questions answered, and any concerns or suggested edits, that you bring those to Lane County staff and we have an opportunity to have that conversation. Being that we'd like to bring this draft charter to the next full Poverty and Homelessness Board for a vote. I wanted to provide a little bit more information regarding the charter's changes for the executive committee. The significant change is that instead of having the PHB executive committee kind of meeting 6 times a year, the charter would indicate that the executive committee would meet 4 times a year, and that they would have a more clear focus, which I would encompass as reviewing the annual agenda for full board meetings, monitoring the implementation of the Poverty and Homelessness Board strategic plan when that is created, review and comment on relevant legislation, and so to raise up advocacy opportunities at the state and federal level, and also work in tandem with the Human Services Commission to share what advocacy opportunities they might have to lift up. And then lastly, work with the Human Services Commission to develop that advocacy agenda, joint education opportunities, and a joint annual meeting. And so it might be that there is an opportunity for that joint annual meeting to be between the Human Services Commission and either the full Poverty and Homelessness Board or maybe just the executive committee of the Poverty and Homelessness Board, considering what might make the most sense. And so the hope with that change is it separates a bit the focus of this body from the focus of the Poverty and Homelessness Board. So it doesn't feel like the two groups are talking about the same things, which I know I've gotten that feedback a few times from members. So I wanted to open it up and see if there is any additional feedback regarding the charter from the executive committee members. Mayor Venus?
Oops, I'm sorry, I was muted. I said I'm looking to the queue, and I called on your Mayor Venus, but you didn't hear me at all.
Sorry, I was just trying to be polite and not impatient, so there we go. So thank you for this. So I have a couple of points, and it could be that we can follow up with where I could write some of these down. But the thing that has just struck me is that the executive committee, one of our second responsibility in those 4 meetings is to review progress on the strategic plan. But actually, in this charter, the strategic plan is not mentioned at all. So I think that in this, it seems to me that in the purpose section, after this sort of general purpose, that you actually then need an item that talks about the strategic plan. And it's pretty hard to hold ourselves to any performance or anything else if we haven't embedded that in there. And it feels to me like that also then is going to be needed to be embedded in the board roles and responsibilities of the internal functions. Again, strategic plan, right? So that,
yes,
right. And then maybe we could be a little bit more specific about what that data collection needs to be, because again, there's sort of reference to sort of performance metrics, but as we've just talked about with the continuum of care, the sort of quality of the data and the data we're trying to collect that data on, the nature of the services we're providing, what are the outcomes of this? I think the strategic plan needs to be able to identify what data should be collected. So then when we're doing those subsequent actions, it's right, it makes sense. And let's see, and it may be that if we clarify, so in the section of purpose, third section, you have 6 points there. It may be that if you have a new number 2 that is the strategic plan, and you play and describe what that strategic plan, what kind of data is, you may not need this 6th point, because that's a more sort of general way of saying the same thing. So just a thought there. And then I wanted to, I think one of the things that we've stumbled over, and we've gone through this huge envisioning thing, one of the things we've stumbled over is that we use sort of general words to describe our work, which as general words, they're great. But then when we get right down to it, we go, well, what is that work exactly, right? What does that actually mean that we're going to do that? And so I think there's a little bit of a problem with that in the external functions. Towards the end, that you have 5 of those there. C says, assure the coordination and implementation of a housing and service system for people who, I don't know how this body would do that. It feels like how would we is that part of overseeing the strategic plan implementation? I don't know how that would work, and I'm afraid that we're putting something in there that again it's not actually the purview of the PHB, but again, I don't know exactly what we're meaning by assure. And that's true again with E, ensure consistent participation of COC programs in HMIS. I don't know, is that a job for this advisory body, or is that really a county staff job? So, it's partly just what do we actually mean by those words?
Thank you. I really appreciate your feedback, Mayor, and just the point regarding what is meant by those words. The 2 points you made under external functions are very much taken from HUD requirements for continuums of care, and that's how they were kind of arrived in the charter. And I think to your point, there can be greater specificity regarding what they mean and how to, achieve those efforts as the Poverty and Homelessness Board.
Yeah, I mean, it might be that even there's a bullet or there's a section. If you feel like you need to leave that in because of the HUD language, that we might specify what that means for us in particular. Like is it because we're going to review our strategic plan and review the metrics, and we're going to do that twice a year, or, what does that actually mean? But I think if everything references back to the strategic plan, since we're working so hard on that, continuing to remind that there's a strategic plan. This is where we refer to it again. This is why we're collecting this data. This is how we're doing that. I think knitting that through will help us keep focused on what it is that we actually can accomplish as a body.
And I'm going to say thank you for bringing those points up, Mayor Venice, because it's important that this body understands both its significance of the work that we're doing and that we're clear on how we are being effective in making our recommendations. And I think what you're suggesting, what the mayor's suggesting, Kate, is going to help us clarify that in the eyes and minds of the Poverty and Homelessness Board members, making us all better participants, I think. I see no one else in the queue with questions.
Yes, absolutely.
I do see Chris McAllister's got your hand up in the queue. Thank you, Mayor Venice.
Thank you, Commissioner. Thank you, Mayor Venice. I am the second person to have served in the lived experience seat of the Poverty and Homelessness Board. I followed Hugh Massengill, who helped set up the original strategic plan. And then after I took over his seat, after he resigned in 2016, we moved on the strategic plan. I feel that whereas we talk about the PHB following and working on the strategic plan, I felt the strategic plan is what gave the PHB something to work on. And we have not been able to have an update of a strategic plan that we could all rally behind. And so I feel like sometimes we're putting the cart before the horse with the charter stuff, when if we as the HSC and the PHB and the local jurisdictions crafted a strategic plan, we would know what our function is in our data points and our data sets. That's not saying that the work in each direction is not worthwhile, but when we can say that 3.2 is how we lobby for the state to get services here, when we say that 1.6 is where we get children with families to have seasonal supports, those are points that we can rally on. Those are points that we can align grants and other funding mechanisms to. But when we aren't even sure who should be at the table anymore because we've been 3 years beyond our strategic planning session, I really think that we have room to expand. This is a time with the all-in retooling to maybe take it to that next level. So this body is important. This body has not had teeth since we lost our 2016 to 2021 strategic plan. I yield. Thank you.
Chris, I think you're making pretty wonderful points there again. I think if there is a criticism that I personally have of our initial strategic plan was its breadth, and therefore in many of the areas a lack of depth. That we had so many different things. The things that we did a superb job of. But I think, Chris, what you're talking about is getting things in front of the Poverty and Homelessness Board members that make us feel both the ability to affect the work plan and recognize the results in our working together, so that we can report it to our different jurisdictions. So, Kate, do you have any response on that?
I think absolute agreement that the need for a strategic plan is high. And I think, there's a bit of a chicken and an egg, reality of, does the strategic plan come before the charter, et cetera. And I think there is a very high need to solidify a charter to be able to move forward with the strategic plan, which absolutely is the intention. And after the strategic plan, if there's another need to take a look at the charter, then that absolutely can happen. But I think there's high agreement that the strategic plan is the next order of business for the Poverty and Homelessness Board once this charter moves forward.
Chris, does that cover your comments and questions?
It is a good faith engagement, and I'm happy to work further on this. Thank you, Mr. Chair.
Right on. Thank you, Chris. Then without any further comments or questions on this particular agenda item, let's move down the agenda. To the members and everyone present, I do intend to adjourn us by 1:30 on time. So we'll push toward that eventuality as we move into all in Lane County. Give a bit of an update. All in Lane County, we have Kate, we have at least one other member of the MAC group, which is Peter Chavan, on the line with us today. There may be more, but with that, Kate, you want to get started on the update on All In, and I'll comment as you continue. Kate, I'm not hearing you.
Yes, thank you. And I can be brief. Are you able to hear me now?
I can hear you well now, and I have a few comments too, so please continue.
Oh, great, thank you. Okay, thank you. So, as I hope this group is aware, on January 10th of 2023, the governor declared an emergency order due to the crisis of homelessness. And since then, there have been dollars allocated to Lane County and an enormous effort by both Lane County internal programs and partner agencies to move the identified outcomes forward. And so mountains were moved and incredible efforts were made to help us be able to achieve the outcomes that were accomplished. And here is a visual regarding the final outcomes, recognizing that agencies were really working to progress their outcomes for less than a 6-month period, some 4 months or less. And we were able to greatly surpass our prevention outcomes, surpass the number of emergency shelter beds that we were expected to create, and really did an incredible job in being able to rehouse the vast majority of households that we were expected to rehouse through the outcomes. 88% is incredible, especially knowing how challenging it is for folks who are in Lane County to identify housing options, and even more difficult if we start looking at what is affordable for our community members. So just enormous gratitude for all the agencies and staff and the individuals that they were working with to help our community achieve these outcomes. I know that the governor has been lauding both the statewide effort as well as Lane County, and that the final outcome statewide, I would expect to be updated in the next few weeks. If you heard the governor's press release a little while ago, it actually didn't have all our numbers in it. And I imagine that was the case for most communities. So they'll continue to rise, even though those outcomes statewide were fully met. So next steps for All In is that Governor Kotek did extend the executive order for another year through January 10th of 2025. we, Lane County, received permission for the all-in round one funds to be extended through, and this should say June 30 of 2024. And so what that means is programs that received funding in round one still have dollars to move their programs forward. Prevention assistance being the only exception. Those dollars did end. However, we were able to spend them out, so that was fantastic. The executive order does extend the requirement of working with a multi-agency coordinating group, and so the MAC will need to continue. And the executive order created a state-level interagency coordinating group on homelessness. And so the governor created a table for state agencies to come together and talk about how to address the needs related to folks who are houseless. Lane County also received approximately an additional $19 million in what I refer to as round two all-in funding. The $19 million supports prevention or basically rent assistance. It supports rehousing and outreach efforts, as well as emergency shelter. The focus of all those dollars is on maintaining and sustaining the work that was done and the beds that were created during this first executive order time period. And these round $2 will extend out a full 18 months, so through June 30 of 2025. And it also provides opportunities to continue to focus on systemic efforts across the Lane County response system. So I'm glad to be able to have that focus as well. We are very fortunate that we received these dollars and that overall this executive order has gone well in the governor's eyes, and so the additional dollars were allocated, and we'll continue to work with our partner programs to discuss kind of what it would look like to maintain and sustain those round one programs that were created. But again, just want to celebrate the all-in outcomes that were achieved. Pretty impressive, and I think one of the first opportunities for our community to really track outcomes in this way and work toward overall community goals.
Well, thanks.
Anything else you'd like to add, Commissioner?
The only thing I would say is that if you do go to our website, Kate put up the dashboard. If you click on the dashboard, you'll see there are underneath each of the categories, there's a view details. And bear with me just a second. I've lost my dashboard, but anyway, if you click on view details, it gives you an in-depth view of which agencies were providing the beds and how they fared toward their goals. So there's a great deal of depth of information on our dashboard. And the only other thing I'd say, Kate, is that when Governor Kotek was down here, she was really rather effusive in her praise for the cities of Eugene and Springfield and the smaller cities and Lane County's coordination of efforts and making so much of happen. And Mayor Vinish, you're nodding your head. I think across the board, Mayor Kotek was very, very pleased with how we here in our communities had responded to her emergency order. I see in our queue, I see Chris McAllister is the only person with a hand raised. So Chris McAllister, to you, please.
Thank you. I had the honor to walk with Governor Kotek through one of the unsupported efforts in All In. And while we talked, we were able to share about some of the work that the MAC groups, task groups had been working on and providing. And she said that the work that Lane County is going to help influence what we move forward on. And so I just want to reiterate that as we collect more data, as we continue to do the communication chains, things like this are going to be what's going to help us get out of not completely, but get out of the current spell that we're finding ourselves in. One of the reiterations that we've asked for is collaboration over competition, and she was very supportive, and the First Lady was very supportive. First Lady, being a social worker, sees what we do. And so I just wanted to say that it's a very powerful approach when Lane County rises together completely and holistically. And this is one of the few instances that has allowed us to do it since we deviated from our strategic plan. Thank you.
Thank you, Vice Chair. Any further comments or questions? Then there's a lot of information in here, Kate, and we're all very pleased that the governors both extended the deadline and provided the next round of funding. Anything you'd like to add?
I think, again, just appreciation for our agencies, all the staff. Sorry we weren't able to move forward with the all-in celebration yesterday. Of course, our ice and snow crisis was number one priority, but really just want to take the time to celebrate the excellent work of all of the related agencies, both with All In and beyond, because we know there's a lot of agencies that are doing incredible work that weren't able to be involved with All In.
Excellent. And we anticipate that the MAC group will continue to meet as the same group as we go into the new round of funding. Is that correct, Kate?
It is, yes. That's a requirement.
Excellent. And I see I earlier mentioned that Peter Chavan is with us. Peter was at, I think, just about every single MAC group meeting. Anything you'd like to add, Peter, about the process or what your observations? Perhaps not. I'm not seeing your mic unmute, Peter. So anything else on All in Lane County? Then thank you, Kate Budd, and we'll move on down the agenda with the jurisdictional updates. We don't have quite as much time as we'd hoped for, as we'd actually anticipated. So quick jurisdictional updates. I'll do mine last, and when I get to mine, I'll just talk about the current Emergency Operations Center that's providing help throughout the recovery from the ICE emergency, and I'll talk about that. Our public safety task force has been convened. So if I have time for that, I'll talk about it. If not, we'll start with anyone from Cottage Grove here today. I see no response on that, so I'll move along to
Commissioner.
Oh, yes. Oh, I know you've been hanging out in Cottage Grove a lot, Chris. Go ahead.
Yes, sir. We were able to get the state of Oregon to respond to the Office of Resiliency to send down an HVAC trailer and generator to try and keep the only staffed camp down there, which Carry It Forward runs, to do it and provide meals for the last few days. And also the city assistant city manager, who is also a MAC group member, Mr. Jake Boone, has been doing overnights at the city hall, which is there are only two places in Cottage Grove that have generators: the Safeway with limited hours, and the city hall where the jail is. And so between the two sites, we've been able to help keep people fed and with a limited amount of power and whatnot, mostly for the oxygen tanks and other people who are more fragile. But Cottage Grove was completely dark. Cresswell is completely dark, and some of the damages to the lines may take weeks to go. But the spirit of Cottage Grove is very, very strong.
And throughout the emergency, as it has progressed, Chris, both Kate and I stayed fairly close in touch with you as you gave updates and reports as to what was happening. I cannot extend my appreciation, everybody's appreciation, on how much time and energy you personally placed into that community. Well done, Chris.
Thank you, sir.
Then to the city of Eugene, Mayor Vennis, I'll look to you or anyone from your staff.
Yeah, I have an update, but first I just really want to thank Chris and I for the incredible work keeping people alive during this storm, and I want to thank the county for the declaring a state of emergency, and again, kudos to the governor for a state of emergency, which hopefully will help us in the long term and pay for some of these responses. So thank you to all of you who just worked so hard and stepped up to help us get through this. We're not done, and we're not done, right? This is the lack of power resources across the community is really going to continue for a while. On the good news, the city of Eugene has partnered with the municipal court and with community-supported shelters on a Department of Justice grant, which will enable us to open a site for people who are going through court processes. So this is a way of ensuring that they actually meet their court dates, they have a stable place to stay, they're, rested and in a better living situation so that they can sort of go through the process. We're very excited about that partnership.
Thank you, Mayor Venice. And, I live in Eugene, so I get to see a lot of the things that the city of Eugene does firsthand. And anybody who doesn't live in Eugene sometimes doesn't have an appreciation for the amount of work that goes in through the city of Eugene, supporting our partner agencies and our community organizations. It really is, it's a sight to be seen, Mayor Venice. So please pass along that appreciation. Then we'll look down to the city of Springfield. And Erin, I believe you may be the person for that. Are you here, Erin?
I am. I think right now, just the immediate focus is we're in a declared state of emergency. I think Sub is still on a boil water notice for about 2/3 of the city. City Hall currently has power, though, but a lot of folks don't. So trying to figure that out, and what does it mean if it's going to be a couple weeks? So the operations center is up and running, and we're talking to Sub and the school district about that, and trying to figure out, are there some potable water solutions, and how do we get the word out about where people can go? And Chris has certainly been helpful in keeping some things to mind in terms of what folks on the streets may need. So that's certainly been helpful, but it's pretty bad out here with all the trees and power lines, and I think it'll be a couple weeks at least for some folks without power. So what does that mean in January? Yeah.
Well, if the weather's mild, I think particularly out in the Thurston Hills, I think one thing that did happen in Springfield is that as the Egan Center was preparing, and the Memorial Building was preparing to shut down, there was really no place for people to go. So everybody banded together and was able to keep that center operating past I think it's normally a 9 o'clock deadline when people are asked to leave the building. So everybody put a great deal of effort out in Springfield, and still there's, we're not talking in days or even weeks. I think we're talking in months as far as the recovery is concerned. Thank you, Erin.
Yeah.
Anything from any of the other cities or communities? Then I will just briefly state the Board of Commissioners did declare an emergency on Tuesday. Boy, the days have run together this week, haven't they? That was Wednesday. That was Tuesday evening, which did allow for the cities and other localities to potentially get federal assistance as we do move through the recovery phases. There's a big step that we were able to take in an emergency meeting. As far as our emergency operations center is concerned, the county has a center set up. It's operating very, very lean. We have a cooperators call. Lane County is, as we all know, about the size of Connecticut. And some of the greatest needs are at the end of 1 mile long driveways where there are people who are stranded, and really there's no real means, no resources to get to all of those. I say driveways, sometimes it's local roads, whatever it may be. But we have people throughout the county that are really in remote situations without communication that we're still trying to get to. And so it's once again, it's not going to be days, it's going to be or weeks. It's probably going to be months before we get this particular ice emergency cleared. And once again, helps us to be more resilient, I think, for the future. That is really all I'll go into today as far as Lane County is concerned. We're getting close to the adjournment time. Anything that anyone else would like to add from any of the jurisdictions regarding an update or just a check-in from our localities? Go ahead.
Commissioner, I wanted to just let folks know that the Human Services Division is beginning the planning regarding our next fiscal year budget. And what we are seeing is a pretty significant reduction in the overall availability of funding to support not only the homeless crisis response system, but also the community action programs that currently have contracts with Lane County. The primary challenge is that the American Rescue Plan Act dollars are waning. There was a significant infusion of dollars both to the county and the state of Oregon. Many of those dollars were able to flow through the Human Services Division and are being well used. Unfortunately, those dollars do end, and there was a finite amount available. And so as we go into the next fiscal year, there are very few ARPA dollars that we will have left. And so we'll continue to share more information regarding the planning and opportunities for advocacy and or opportunities to apply for funding. But just wanted to share this messaging that it is going to be a time for very difficult decisions. And I think this is a reality for many jurisdictions across the nation as the ARPA dollars start to wane and we start to go back to pre-COVID funding if we're fortunate to be able to get there. Thank you for the time.
And thank you for that, Kate. Then I'll briefly go into our next meeting. Next meeting is on February 15th. There is a draft agenda as item 10 in our agenda packet today. I'll ask you all to review that and take a look at that. If you have any questions or comments, please forward them to either Kate, Bud, or to me. And just a quick summary before we adjourn for the day. On today's meeting, next steps. A reminder for nominations for the February voting on the officers of the PHB. Forward those to Kate, Bud, by the 10th, if you possibly can, by the 10th of February, and we'll engage in that vote on February 15th. And the second thing is just a reminder regarding the urgency that Dr. Ludke gave us at the start of the meeting to get our voices out, uniform and together. I've got a bullet point of things that I'm going to be passing along to the Board of Commissioners, and I think Dr. Ludke did a good job of both alerting us to the urgency and the possibilities that we can forward to help avert an even greater emergency. So with that, is there any more business for the order of today's agenda? I'm looking around to, I see no hands raised. Kate, Bud, anything you need to add before we adjourn? Then
I do not. No. And just to clarify, looking for nominations to be made by Monday, February 5th.
February 5th. I'm sorry. Thank you very much. February 5th. With that, as promised, we can all go back to our day because we all have a lot of, if you don't have a driveway to clear, I'm sure you've got plenty of other things you can do for the rest of the day. So with that, au revoir to everyone. Thank you for participating today. We are adjourned.